welcome to our Wellness 360 educational series. Today I have some exciting news. My name is Beth Parry. I am one of the owner at Wellness 360, and we believe in educating our clients and our participants because education is the first step in making changes for your health and wellness. So if anyone knows me personally, you know I have a place in my heart for Eastern theory and for acupuncture. So today I have brought to you Dr. Olden. He is the owner of Mindful Medicine Rochester. Why don't you say hello for us, Dr. Olden?
Hi, everybody. Thanks for having me, Beth.
Awesome. We're so happy you could come. Could you just introduce yourself? Tell us a little bit about yourself, why you chose acupuncture, how you started.
Yeah, sure. So I did my training in internal medicine, which is, pretty similar to a primary care physician, a practice that a primary care physician would have. And I geared myself a little bit more towards palliative care, which was treatment for folks with chronic illness. After doing that for about 10 years or so, I would say that I became a little bit disappointed with our Western medical system and the emphasis on really kind of covering up problems with medications and treating, disease with medications. And I became more interested in looking at the whole person and wanting to really assess what's the root cause of what problems this person might be having. So I had some experience in yoga, and acupuncture was really helpful for me personally. I received acupuncture many times, and I thought, what better way to help the community than to kind of combine my knowledge of Western medicine and my love for Eastern medicine, so yoga and acupuncture and meditation. And so I decided it was time to open my own practice so that I could help people really manage their health in a more holistic way.
I think that is so awesome, Aaron. So I found Aaron I work at Genesee Valley Physical Therapy right across the way there in Penfield. And I happened to walk by and see his Mindful Medicine sign on his door. So I just wanted to know what he was all about. And although I work in a very Western culture with physical therapy, they've been so good about giving me the freedom to express my Eastern theory mind. So when people need something a little more, when they're not getting better with your typical Western-minded solutions, they would be transitioned to my practice where I would work with them. And I have incorporated acupuncture with a ton of my patients because I just find that the Eastern theory way of going to the source of the problem as opposed to, medicating and band-aiding and all that kind of things is such a better way and a more holistic way of doing things. So I started talking with Aaron, and we have so many things in common as far as the meditation and the yoga, and acupuncture has always been a dream of mine, not one that I ever went through. Coming from West Virginia, the closest school was a couple hours away, so it really wasn't an option. So I have personally experienced Dr. Olden's work. He is absolutely amazing. The first time I left his office, I felt like I was on cloud 9 for days. I felt amazing. So let's talk a little bit, because I think this is really interesting for people that aren't aware. I get a lot of questions. I answer and field them the best I can, but having you here, we're going to go for it.
Yeah.
So can you explain to us in your mind, what is the difference between Eastern and Western theory?
Yeah, good question. Do you have a couple hours? No.
Maybe we could just skim it.
Yeah. So I think, in a general sense, when you think of Western medicine, you think of an MD, right? Like a medical doctor, a physician assistant, a nurse practitioner.
Therapist.
Exactly. You think of these traditional clinics and hospitals, and you diagnose a person, and then you treat a person. And it's really like the focus is really on a lot of testing and on treatment generally with medications. We don't really focus a lot in Western medicine, unfortunately, on prevention, right? Like we look for disease after it's already started. And I don't really blame my colleagues for that. I don't blame physical therapists, doctors, nurses for that. I think it's a system problem. It's a problem of our system where somebody comes in, they've already got a problem, they've had it maybe for years, they haven't sought medical attention, and it's to the point now where we've got to put a Band-Aid on it.
This is one of the reasons that I'm trying to educate everyone, and I started these Friday night discussions, because I feel the more knowledge that people have, the more they can take the steps to seek out people like you, people like me, your massage therapist, your acupuncturist. I really find that, yes, I agree, it's completely a system problem, but I'm hoping that by educating the participants and the public, that maybe they would have enough knowledge to seek out the right people, because normally you and I come at the end. You and I are the ones where the Western theory is not working, they're years into the progression, and then we got to try a different avenue. Oh, let's try acupuncture.
And the thing that I love about Eastern techniques, which I think of generally as acupuncture, yoga, you know, these sorts of things, is that they're very focused on getting back to the connection of the mind and the body, right? So it's kind of complicated to talk about acupuncture and the meridians and the different points, but I like to just really simplify it to people and say, look, not all my patients get acupuncture. You know, we might talk about yoga, we might talk about physical therapy, but it's a holistic approach that really, like you said, empowers the patient, empowers the person to better understand their body and to make changes so that they're not dependent on a medical system. I mean, I would actually love to see someone maybe 2 or 3 times for a problem, equip them to make changes, and then not have to see them back, you know, for months, or just do kind of a maintenance thing, rather than saying, okay, well, here's some pills, just take the pills.
Yeah, I agree completely. And I find that just getting the education out there about what acupuncture is might take away a little bit of that fear that people have. As soon as I mention acupuncture, their first thing is, oh, I don't like needles. And there's such a misconception about what they feel like and the reason that they're there. And I find that once they're educated, they're then hesitant but willing to try. But I teach a meditation class every Tuesday night, and my main goal in that class is to bring people back to their bodies. I think step one, and I was talking to Jay Verna last week in an educational series, and I think that step one in any form of wellness and wanting to be healthy, regardless, is just bringing awareness back to your body. We get so disconnected with our bodies, and all of a sudden you have a disease and you're like, where did it come from? I lived healthy. I did this, I did that. But taking that time to do yoga, to do meditation, for me, I can be very meditative on the acupuncture table, but taking that time for you to focus internally, to notice where you feel, what you feel, emotions that may be stirring up that we suppress, just being able to find that balance, to say, you know what, Dr. Olden, I don't know what's wrong, but I know something is off. And then he has these great questions that you can ask, and then he can bring back some balance. But you wouldn't know that that was the case unless you were listening.
Mm-hmm. Yeah, absolutely. I like what you said about acupuncture being meditative. You know, it's I think of acupuncture as a tool to kind of help people re-establish that connection with their bodies. Yeah, the needle is a little bit of a pinch. You know, many people actually don't even feel it go in. But once it's there, I think you would probably agree that you really start to feel the energy in your body, and you can you can reconnect with what it feels like to be in your body. You know, unfortunately, these days, there is an epidemic of stress and anxiety and depression. And many times, what folks will tell me is that it feels like they're not even in their body.
Yeah,
They
there's a disconnect.
Absolutely. And so we're talking about kind of just making that connection again. You know, I said it before, but whatever works for people, I am fully in support of. You know, if acupuncture is not the technique, maybe it's going to be yoga, maybe it's going to be meditation, mindfulness. You know, whatever techniques there are. That's what I'm trying to educate my people about. To find what's going to fit best in their lives.
I think that's really great because, again, it's individualized. It's not that cookie cutter. I'm going to go in with, you know, the cold or flu. I'm going to get this medication and I'm going to leave. This is the questionnaire that you had me ask. I was training in shiatsu during the time, one of the visits. And so it was kind of neat because I kind of knew where some of those questions were going. But they're just really random questions that you don't think about. They're questions that you wouldn't think, oh, I don't know how I feel about that, or oh, do I get fearful, or what does me being fearful have anything to do with my ailments or what the way I'm feeling? So it's just bringing that connection back between your emotions, your energy, your body, how you feel, your perception and your interpretation of how you feel or the circumstances that are around you. And I agree with Aaron that acupuncture is complementary to just about anything. So I don't call them alternative therapies. I call them complementary therapies.
Love that.
Yeah, I just feel like they work together. So if you come for me for one of our exercise programs, we're not basing your entire health and wellness on the exercises. What we're doing is we're finding that balance between your diet. I brought Tina Durham on, so you have a contact. We have Rochester Lifestyle Medicine that we're partners with. So you have that diet aspect. I do not claim that diet is my thing. So, but I have great reference points for people with diet. I do the best that I can, but I'm only human. And then we provide an exercise portion. I'm a licensed massage therapist. There's a million of them out there. So find one that works great for you. Then we have the meditation portion. And then Dr. Olden has the yoga. He has the acupuncture portion. There's so many different avenues that we can take because it's not just one pillar. Wellness, wouldn't you agree? Wellness is a bunch of different pillars working together to hold up the structure.
Yeah, I totally agree with that, Beth. And I think what many people may not know is that this theory of looking at an individual from a biopsychosocial approach, meaning biology, psychology, social situation, that actually was born here in Rochester. So at the University of Rochester back in the 70s, the approach of training of medical students and residents was, let's not just look at numbers on a piece of paper. Let's just, if we have somebody coming in with, let's say, a new diagnosis of diabetes or a high blood sugar, right?
Yeah.
Let's not just look at an elevated blood sugar. Let's talk about, well, what's the psychology, what's the psychological well-being of that person? Could there be depression that's causing the person to eat unhealthy foods, right? Could it be anxiety that's contributing and raising stress hormone levels in the body, and that's contributing to high sugars? Could it be that the person has possibly lost their job and can't afford healthy foods, right? So if we just look at one aspect, if we just look at the sugar, we're missing the big picture of the individual. And, that's the type of practice, even prior to doing my current practice, mindful medicine, that's the way that I trained. There's so much more to an individual than a piece of paper and lab results.
I could not agree more with that. And I, for myself, find that acupuncture is very effective for me. Last time I went, I mean, the energy that whatever needle he put in, I could feel it. I had so much energy, and he knew to stop there. He knew, you know what, let's just leave it here. Let's just hold here for a while until you can feel that kind of balancing. Now, for me, when I talk about energy, people are probably wondering what I'm talking about, and that's okay. For me, this is what I do for a living, and this is what I'm very sensitive to. So it's something how I work. Doesn't necessarily mean that you have to work that way, but maybe it's just you feel happy, or you feel more balanced, or you feel more stress reduced, or that's just kind of another way of saying it. So let's talk about the needles. I know this is a big question. I have a couple questions so you can field them how you want, but A, why do you put the needles where you put the needles? And B, is there different cycles? Is there a cleansing cycle? Like, why is it sometimes when people leave, they say they don't feel well? And three, what do they hurt? So that's the big question. I can say for myself, I've had 2 needles hurt in my entire life. I'm 41. I've been going to acupuncture since my early 20s. And as soon as they moved the needle or turned it, I don't know the proper terms, it felt much better. But the rest of them, it's like a little prick and then it's done. So field those couple questions for me, however would be a best way for you to field them.
I think those are great questions, Beth. I would say that people might be surprised to find out that I myself grew up with a fear of needles. So the fact that I'm doing this now is a little bit of kind of a surprise to me. If you'd asked me, 5 or 10 years ago, would I be practicing acupuncture? I'd be like, no, I'm not a fan of needles, but they are so small. So if you think about getting a blood draw, right? I think probably most people who are watching have had their blood drawn. The size of that needle is a particular gauge, right? And then the needles that I use are so much smaller that you could probably fit about 15 of those needles into one of the needles that is used to draw blood. So
that is a great description. Really good description. Thank you.
Yeah, so they're hair thin, they're so small. In the odd case that one happens to fall out or fall on the floor, they're very difficult to find because they are so small. So I think anyone that comes in is a little bit concerned about how it's going to feel. I'll usually pick a particular point or two that I know are generally tolerated extremely well. And I don't think I've had anyone in my last couple of years of doing this that said that was a painful experience. So go ahead.
No, I was going to say, it just reminded me of a question that someone had asked me about with the needles. Sometimes people say, well, it hurts in my shoulder, but you're putting them in my feet. Mm-hmm. Can you explain, because I do my best to explain it, but I'm not an acupuncturist. So can you give a good explanation? I've had a couple patients that have been like, well, my knee hurts, but they were put in my shoulder, they were put in my head. Like, I don't understand, like, work on my knee, because the Western theory mind, it just came to my mind. I want to make sure that I don't forget that question, because it's very important for people I've talked to.
Yeah, so the decision on where to put the needles is a complicated one. And I would imagine that if someone with knee pain went to 3 different acupuncturists, they would probably get 3 very different treatments, probably similar to even a massage or physical therapy. If someone's coming into me with a particular joint pain, I do focus on that joint for sure. And I do an exam of that joint, and I test the muscle and the strength of that joint to see what the deficits are. More than likely, I would say probably, 95% of the time, I am going to put needles in or near that joint. But if we think about our body, our body is a system and it's connected, muscles are connected, and then there's this layer of tissue, which we call fascia, which is really just connective tissue that lays over the muscles and connects around the whole body. So, the points, if someone has a headache, it could be that there's tightness up here that extends all the way down towards the connective tissue in the feet. Now, if I'm treating a distant location. So if I'm treating someone with knee pain and I'm giving them a needle in their foot, I might actually be using that needle because of its effects on stimulating our part of the nervous system that allows us to calm down, or stimulating a point. There's one in the ear that is very effective for pain throughout the whole body. So generally, when it comes to pain, I might use points in other areas of the body that either are connected by connective tissue, or I just know there's one in particular on the foot. It's called a sedation point. And I use that often on people who are kind of a little bit anxious. In my practice, many times when I put that point in, I'll have someone say to me, you know, I'm feeling really calm, really, you know, like I could just take a nap right now. So in a way, that's the reason for distant points. I would also say that, getting back to kind of your question about Western and Eastern medicine, the way that the traditional Chinese think about the organ systems is very different than the way we think about it in Western medicine. So in Western medicine, I'll give you an example. We think of the kidney as responsible for producing urine, clearing toxins. There are also some hormones that are produced in the kidney. In Eastern medicine, in traditional Chinese medicine, the kidney is thought of as kind of the reservoir for qi, for like the life force. And also, if it's deficient, it could be, they think of it as possibly causing fear or anxiety or depression. And so many acupuncturists will choose to strengthen the kidneys so that the body itself can accept the treatment. Think of your car with having low levels of gas. No matter what you do to get that car going, if you don't fill the gas up, you can go get it washed, you know, you can clean the ends, you can vacuum the inside of it, but you have to fill it up with gas first for it to work. So that's kind of the reasoning for addressing, you know, the point for the kidney that many people use is in the foot. So that would be possibly a reason why one might say, well, you're putting one in my foot, but I have shoulder pain. Well, I need to get your body to accept the treatment. And this is what the traditional Chinese would say is really an important thing, is we want to strengthen that kidney energy, if that makes sense.
That is such an awesome explanation. Thank you so much. Again, remember, we're treating the whole body. In Eastern theory, sometimes in Western, we like to break our body up into blocks, into little, well, shoulder injury, we treat the shoulder. And if you've ever talked to a physical therapist, you know that insurance expects the same. So if you're working on a shoulder and I start working on your neck, it's really hard to justify the two, why they work together. But in Eastern theory, you're working on your body as a whole unit. You're working on your body from the emotional standpoint to the fascia, to the meridians, to everything works together as a system. So like Aaron was saying, that, you know, if you're anxious and being on the table, your body's put up that resistant wall and it's not going to accept anything from something you fear, correct?
Yeah, and it kind of touches a little bit on the idea of holistic medicine. And I think, I'm hoping that the folks that are watching are not getting confused by all the terms that are getting thrown around. But this is unfortunately the way that our society is right now. We have holistic medicine, we have functional medicine, we have lifestyle medicine. You know, it gets really confusing for people who aren't part of the system.
Yes,
And
it does.
to boil it down, I think that many of these are similar. Lifestyle medicine, holistic medicine. My approach is, I like to talk to people about a tree with a diseased branch, right? And if we only concentrate on the branch that is diseased way up high, and we don't look at the roots of what's really grounding that tree, then we're kind of failing that tree. We're failing the person. And so when we talk about getting to the root of the problem, that's what we really mean. We mean, you know, that maybe that's why you're having a point in your foot, or maybe that's why we're focusing on the roots, because that's where the essence of the problem is. You know, we want to get really deep down to why is this happening? Because if we just take off that diseased root, or that, excuse me, that diseased branch, there's going to be another diseased branch that's going to come.
Yeah, it's not going to change the limbs.
Like,
I think that's amazing, and it makes me smile. It makes me so happy when I can talk to like-minded people and really talk about just the balance and just, and the guilt that people feel about, well, I tried the best that I could, but I got this disease, or I have this ache or pain. I have a couple people that have been struggling with pain, and it goes from the knee, then to the foot, and then to the hip. And yeah, I'm sure there's some compensatory things of the walking and gait pattern, but there's so much more that we're ignoring. There's so much more. And when I start working on fascia, I specialize in myofascial release. So I'll start working on the neck and the head for sacrum problems, and people don't understand the connection. But it's all, I consider like the spine and the fascia, like the Jenga system. When you're playing Jenga and you push one of those little blocks out at the bottom and the whole system shifts, you have to rebalance that. You have to bring all the blocks back into a nice, strong foundation so that it doesn't tumble over.
yeah, and that kind of, just to kind of tag on to that, I think that that probably helps people understand also why when you see a massage therapist or a physical therapist or an acupuncturist, you're probably not going to be told that you're going to be fixed in one visit, right? Like,
Yes.
if if you have a plant that's not doing well, it's going to take some time and some care to really nurture it back to health. So what I tell people when I see them is give these treatments 3 treatments, right? Like, commit yourself to 3 or 4 times, because we're going to be working together. Like, when I see someone, I'm sure the same thing with you. I see someone with pain, or let's even just talk about someone with anxiety. I'm going to give them some tools when they leave. So it's not just an acupuncture and then nothing for another week or 2,
Right.
right? Like, we're going to talk about possibly sleep or exercise or adding meditation in, because we want to nurture the entire individual, and we don't want this to be thought of as an isolated visit, right? Like, okay, I'm just going to go back and do all the other things that I was doing.
Yeah, I tell people it's like losing weight and getting to that goal weight and then going, well, I hit my goal weight, I'm going to go to McDonald's for lunch.
Right.
Like it's a lifestyle change. And it's so funny. And I did not do this on purpose, but my talks with Jay, my talks with you, my talks with Tina, all what I would consider wellness experts, they all just said the exact same thing. It starts with mind-body connection. It starts with sleep. It starts with taking care of yourself, with yoga, with meditation. We've all said the exact same things. And that's coming from 4 different healthcare professionals of different fields. And we so really and truly, if you're curious about any of those topics, go back through our educational series. We have topics on sleep. We have topics on meditation. At some point, I would love to have Dr. Olden come back and talk more about the meditation, because I know we have a lot in common when it comes to the meditation. I just listened to one of Aaron, and I'm sorry I don't remember the name because I was driving when I was listening to it. Who did you just do the interview with?
Oh, right. So I spoke with a guy named Archer Paulins, who is a breathwork coach. And, I really wanted to learn from him, how is breathwork, sort of in quotes, how is breathwork different from meditation or mindfulness? And the way I look at it is that it's a tool, right?
Yes.
A tool
Yeah.
that's available to us.
It was such a great talk. I absolutely enjoyed it. I made it all the way almost to the end, and I was so excited, and I accidentally tapped my phone and it disappeared. So,
Modern technology.
and
Yeah.
while I'm driving, the last thing I think I need to be doing is fooling with my phone. So, that was such an amazing thing. And I teach people like meditation. Mindful living is like someone saying healthy living, and meditation is a tool. Breath work is a tool. Yoga is a tool. You find what tools work best for your body to bring about that mindful living, that balance.
You know,
Um,
a thought came to me, Beth, as you were saying that. I think that we are really fortunate to have providers like you and like the others that you mentioned, getting the word out there, because what I really don't want people to think is, I guess I want people to get out of the thought process that their health is to be determined by a doctor, right?
Correct.
I want to empower people to become healthy, to not depend on us, to learn from us, right?
Yeah.
Take our knowledge, but then apply it. Because too often, I think, you know, I think all too often, folks, um, you know, they do kind of just relinquish their health to the medical system. Oh, I'm just going to wait until my next appointment and they'll tell me what to do. Or, you know, I've received this diagnosis, and, you know, you go on to Google or whatever, and, you know, you become really fearful. And I really like the idea of empowerment. And that's what these talks are about. And that's what visits with me, and I'm sure with you, are about, is here are the tools that I'm going to give you, that I'm going to teach you, so that you can bring your health and your wellness back into your own hands.
Absolutely. That is my goal in life. And I feel like if everyone has a life purpose, mine is I want to empower others. Everything in my life is about education and about learning. And yes, I would love for you to come for my exercise classes and all of those things that provide a lifestyle for me. But in the same breath, that if I never see you again, I tell people all the time when they come into me, maybe we could just grab, you know, coffee or a hot tea sometime. You don't, you know, I don't yearn for you to come to me for an appointment, which actually brings me to my next question for you is, what is your, like, why would I want to come to you? Like, if I was going through life, okay, I've taken Beth and Dr. Olden's advice, I'm meditating and I'm feeling a little off balance. Like, when is the right time to come to acupuncture?
Great question. I think, you know, if you are curious about it, if you are open-minded to it, if you are looking for an ability to reconnect with your body, and possibly have tried other things that maybe weren't for you. You know, yoga requires a certain amount of ability to stand or sit for a long, you know, a period of time. Acupuncture is relatively passive in that you lie on a bed and have the needles placed.
Yeah.
I think when you think about a physician, right, a doctor, what I hear from a lot of my folks is that they don't have the time to explore some of these things when they're at their physician's office. They've got 10 minutes, and 8 minutes of that is spent with the provider focused on a computer typing in and looking through history. And so there's 2 or 3 minutes to actually have a conversation. So if you want to have, my visits are an hour, or often an hour and a half, depending on if it's a new or a follow-up visit. So there's a lot of time for us to explore health, to explore recommendations, to explore what the root cause of a problem might be. If someone out there is thinking, I don't want to see a provider that's just going to put me on a medication, or I want to treat my pain with a complementary therapy instead of a pain medication. I want to treat my mood, or I want to work on my sleep without taking a pill.
And just a nice reminder that Dr. Olden, he is a doctor. That's where he started. So don't fear if you feel that someone needs something different. You have the knowledge base. And for me, if I treat you for a couple times and I'm like, you know what, I really feel like you should see your MD, or you should try something new, because you know, I'm not a doctor. So just, I think we can all share that we all are not in it to keep you forever. We're all in it to get you better. And if we feel that there's something, another treatment that complements what we're doing, or you need something more, we refer.
Right. And it's a team approach, like you said. So I view myself really as a team player. If I'm seeing someone for a particular pain and treating them with acupuncture, and after a few times I feel like, you know, this is not just a muscular problem. This is possibly like a postural problem, or a problem that I think needs more attention from physical therapy. I will refer and I will collaborate with others.
Yeah.
Uh, I think that that's really, really important that we work together as a team.
Yeah, I couldn't agree more. My dog has decided he loves you. She won't leave
Oh,
my side. That's why my arm keeps moving, because she's like all over me right now.
oh, I love dogs. Yeah.
So, talk about insurance a little bit. That's another question I get a lot. Do you take insurance? How does that work?
Yeah, great question. So I, at this point, don't take insurance. I made the decision when I opened my practice that I wanted to be able to make decisions that weren't based on insurance companies saying what I could do or couldn't do. So at this time, I'm not taking insurance, but I do have the ability to use like a health savings account, or say like those savings account cards that people have. So that we can definitely do. And then you know, if it's hard for someone, or if it's a financial difficulty, I'm more than happy to work with someone and say, okay, well, why don't you come into me once, or we do a one-time evaluation, and then we think about, there's other acupuncturists in town that offer kind of sliding scale fees. But you know, to be fair and to be clear about it, many times those types of treatments are going to be done in a group. So you'll be receiving acupuncture in a room with maybe 3 or 4 other people, fully clothed. They might, you know, roll your sleeve up so that they can get points here. But those resources are available in town. So I am more than happy to work with people and help them find what's going to work out best for them. But I believe that I keep my fees very reasonable. You know, what I charge is not very different from what a massage therapist, a private massage therapist might charge. And you're going to get a good chunk of my time. You know,
Yeah, I can agree with that. I've been there. I've been a patient, so I can definitely, although, um, I definitely agree. I've been to other acupuncture places in town, and it's very comparable to what you would pay. I have a lot of people that say it's too expensive. I can't do all of this stuff for myself. Meditation is free.
Mhm.
Yoga, YouTube has so much yoga on it, it's free. Um, Another thing is, and then once you start to meditate, and this is what I find to be what I teach in my class, 10 minutes of meditation a day, you are going to be mind blown at how your brain changes, and how all of a sudden putting you first and paying a little for this preventative medicine is now priority in
Mhm.
your life, and you find the money. It just happens because your brain starts to shift with meditation. Your brain starts to shift, and all of a sudden your priorities slowly start to shift. You start to respond to life and not react. The
Mhm.
first time you hear how much it costs, you're like, oh my gosh, I can't do that. That's a reaction. And all of a sudden, when you're meditating, you're like, you know what? That's a lot, but I might be able to balance it out with not stopping for my soda every day, or giving up cigarettes, or not going to eat takeout, maybe eating from home. You'll start to notice that you have a lot more money and a lot more resources than you originally thought, because your priorities have shifted, and all through 10 minutes of meditation.
I couldn't agree with you more. I'm not sure that I would have been able to get through and continue to get through this time. My office has been closed for the last month and a half or so, and I'm just now gradually reopening. You know, that's anxiety provoking. This, what we're going through together, I have shared with my clients that I almost look at this experience that we're going through as a traumatic experience that we are experiencing again and again every day. You know, the news, the reports, there's a lot of uncertainty, there's a lot of sadness, there are waves of emotions that people are feeling. You know, I keep hearing from so many folks that they might be happy one moment, angry an hour later, and sad, and then happy again later. You know,
Yeah.
we're going through this cycle, and I think that's something that meditation a meditation as a practice really helps to be able to sit with those feelings, to be able to sit with what it does to our bodies and what it feels like in our bodies, and not necessarily maybe be judgmental about them. That's one of the keys of mindfulness, is a non-judgmental spirit. So
Correct.
I couldn't agree with you more, and there are so many completely free apps out there, Headspace being one of them, that you can access, and you can do these meditations on a daily basis. You could start with a 3-minute one, you can then move up to a 5-minute one. Just give it a try.
Yeah, I could not agree more. It's free. I have a little bit of a debunking thing on some PowerPoints that I do. Um, there is no excuse. The apps are free. The time is there. I love the saying that if you can't find 20 minutes to meditate, you need to meditate for an hour.
Yeah.
We have to really slow our life down. That's number one, slow our life down, and make ourselves a priority. It's so important. I just wish if I could get anything out there, it's just you are worth it. You are worth your time. Before
And
we
I
go,
would also say, Beth, if you can breathe, you can meditate.
amen. Yes, it's so true. That's all it is.
It's
People say,
simple.
well, I can't clear my mind, and we're going off on a whole other tangent. Maybe you and I can get together and do another one of these on meditation. I would love that. But it's not about clearing your mind. It's about turning your focus and your perspective. It's about being able to separate your emotions and your thoughts and your judgments from your thoughts. So
Mm-hmm.
I say it's like standing along a river and the river is flowing by. It's there. You can't stop the river, but
Yeah.
you can separate. You don't have to step in the river. You can separate yourself and find true peace even in the storm.
And I can't resist, as a doctor, as someone who's trained with a very scientific mind, to share with the folks that are watching this that there is very strong evidence, even in the scientific world, for meditation, for massage, for acupuncture, as being as being strongly stimulating to the part of our nervous system that allows us to rest, digest, and relax. Right? We spend so much time in our society in that kind of fight or flight mode of high stress and high anxiety. And like I said, there is evidence that meditation, acupuncture are highly stimulating to the side of our nervous system that is counterbalancing the stress response. Very important.
I agree. I agree. I'm heart math certified, so I have the actual biofeedback that you can hook to your ear
Yeah.
and watch it on the screen. It's so awesome for people to see where they're at and have that biofeedback. So we are running out of time, so I do want to get kind of a recap, give you a moment to talk about your business, where you can find you. I have one more question that I follow Dr. Olden on Instagram and all of the channels. Snoopy. I want to know more about Snoopy.
Snoopy is just, he happens to be here with me today. It's just, I think possibly he reminds me of being a kid, and, reminds me not to take things too seriously. And to, when I see him, I often think, it just brings me kind of a sense of calm. So I have him in my office, and I have, I've got, little Post-it notes with Snoopy on them. I think people know that I like Snoopy, so I've just got all sorts of Snoopy stuff.
I love it. I
That,
just love
that
it,
comes,
and I just needed to know the secret behind Snoopy.
yeah, yeah.
All right, so go ahead and give us just a final wrap up. Anything you find important to say, anything you'd like for people to know where to find you, when, anything goes.
Yeah. So first of all, Beth, thanks for having me on today. I really appreciate it. I have really enjoyed the ability to collaborate with you. Beth and I have, have collaborated on patients, and we're kind of in the same office park over here in Penfield. So thank you for that. My practice is called Mindful Medicine Rochester. My office is in Penfield. You don't need a referral to see me. Just contact me by going to my website, mindfulmed.com. I hope that people will take away from this that my approach is different from your traditional medical doctor, that I'm approachable, and that if you can't financially afford to see me, or if you're not ready to do so, and you want to just learn more about my practice, or you want to contact me, I respond to all of my emails. So simply send me an email, ask me about what I'm doing. I'm happy to collaborate in that way. And I look forward to, when I established this practice, my goal was to really help everyone in Rochester live in a more sustainable and healthy way. And I was discouraged with the inability of kind of Western medicine to help people achieve that. So I'm just trying to help people become healthy one person at a time. And by the way, you can also follow me on Instagram, where I post more probably than Facebook, Mindful Med Rock, ROC.
Thank you so much for joining us. I have always enjoyed our talks. I've always enjoyed our conversations. This is purely meant for educational purposes. We're not here to drive anything more than to educate you. You can follow us. You can follow Aaron and myself on Wellness 360, both Instagram and Facebook for more. This is a pre-recording because Facebook changes their format too much for me, especially someone that's technology, little backward with technology. So I pre-record, that way I can guarantee you can get this at 7 o'clock when we advertise. That does not mean that I'm not available at 7 o'clock. So if you have any questions or comments for Aaron or myself, you can post them below. And we will get back with you with an answer. If you'd like more information, throw us an email address through private message, and we'd be happy to talk to you about anything. I hope that we can have Dr. Olden back on the talk. I'd love to have some time to talk about meditation with you. But until then, thank you so much for joining us, and we will talk to you all next Friday.
Thank you, Beth. Thanks, everyone.